Das Feedback war bei uns durchweg positiv. Also ich fand gestern besonders schön, dass alle so entspannt waren. Also wir haben uns so ein bisschen gefragt, was passiert, wenn die deutsche Community auf die ganzen Länder trifft. Und man hatte irgendwie den Eindruck, die kennen sich alle schon 100 Jahre. Vielleicht liegt es am gemeinsamen Konzept, an dem Spirit. Aber wir hatten allerbestes Wetter gestern, strahlend blauer Himmel. Und ich fand, es war eine sehr angenehme aber auch Netzwerkatmosphäre. Und das hat uns allen sehr gut gefallen.
How did it come that I came to be with Sam in Pathways? Sam and I were in the same New York Psychiatric Institute offices of research, and we became friends because we were next door to each other. And as it happened, my supervisor passed away, and they didn't know what to do with me, so I just became friends with Sam, and we talk every day. And then we kind of went separate ways, and then he came to me one day and he said, I've started a new program. It's called Pathways to Housing. Will you be on the board of directors? And when I heard what it was, I said, oh, you take people who are crack addicts and you take people, you put them right into apartments? Isn't that a scary? He said, it works. Trust me, it'll be okay.
You feel good in here?
I feel very good, yes. It feels like home. I have a home, right?
But in Washington, right?
Emotionally home. No, I mean, obviously I have a home. I live in New York City, but I'm just saying for the people here, and the comfort level is very high for me. I can go to conferences where I don't feel so much, a part of it. Here I feel safe. And with people, even if I don't know them, I feel they're good people. Literally, I judge people that way. So I'm happy to be here.
Ja, sehr geehrte Damen und Herren, liebe Teilnehmende, ich freue mich, heute hier zu sein. Dear participants of the European Housing First Partners Conference, dear Mr. Sam Barris, the godfather of Housing First, nice to meet you. Mein Name ist Cansel Kızıltepe, ich bin Senatorin für Soziales hier in Berlin. Ich begrüße Sie alle herzlich in dieser wunderschönen Location zum zweiten Tag der Housing First Konferenz hier, und ich bin sehr stolz, dass das Treffen der internationalen Housing First Community hier bei uns in Berlin stattfindet. Und ein Blick in das Programm dieser beiden Tage verrät auch, hier kommen Expertinnen und Experten aus der ganzen Welt zusammen, um voneinander zu lernen, sich auszutauschen und zu diskutieren. Vielen Dank an den Bundesverband Housing First, der dieses Forum ermöglicht hat. Danke, Sebastian, und danke auch an den Vorstand. In Berlin bezeichnen wir uns gerne als Vorreiter bei Housing First. Und im Vergleich zu anderen Bundesländern halte ich das auch für gerechtfertigt. Dennoch will ich nicht verschweigen, dass der Ansatz Housing First einen langen Weg zu bestreiten hatte, bevor er in der Berliner Verwaltung auch wirklich Gehör fand. Und wo soll in einer Stadt wie Berlin der Wohnraum herkommen? Diese Fragen hat man sich damals gestellt, teilweise auch zu Recht, und auch heute werden sie noch oft gestellt. In 2 Modellprojekten wurde Housing First in Berlin von 2018 bis 2021 erprobt. Mehrere Projekte gingen an den Start, soziale Träger kamen an Bord. Engagierte Sozialarbeiterinnen und Sozialarbeiter haben eine Idee zum Leben erweckt und die ersten obdachlosen Menschen in Wohnungen vermittelt. Housing First war in Berlin angekommen. 340 Personen konnten wir über Housing First Projekte in Wohnraum auch erfolgreich vermitteln. Wir haben spezialisierte Ansätze für besonders schutzbedürftige Gruppen. Wir haben ein Neubauprojekt einer Genossenschaft, das Raum für Housing First schaffen wird. Wir sind also in Berlin auf dem richtigen Weg. Und ich habe auch einen Appell an Sie. Machen Sie weiter so. Vernetzen Sie sich, organisieren Sie sich, formulieren Sie Ihre Forderungen an die Politik. Der Kampf gegen Obdachlosigkeit ist vielleicht die größte sozialpolitische Herausforderung unserer Zeit. Wir haben mit Housing First einen Ansatz, der funktioniert, der aber auch viele Ressourcen kostet. Das ist auch die Wahrheit. Aber gute Sozialpolitik ist teuer. Ich sage immer wieder, schlechte Sozialpolitik ist am Ende noch teurer und geht auf Kosten aller. Deshalb kämpfen wir weiter für gute Sozialpolitik, für wirksame Maßnahmen gegen Obdachlosigkeit und für Housing First. Ich wünsche Ihnen heute einen produktiven und inspirierenden zweiten Tag auf der Konferenz und viel Freude bei den vielen spannenden Beiträgen und Diskussionen. Vielen Dank, dass Sie hier sind. Thank you for being here. Dankeschön.
I'll introduce what we're going to do today. We're going to have a discussion particularly about how do Housing First networks and platforms and national coordinations help us all to do the jobs that we want to do, but also help us to move that needle towards having a scaled-up approach to Housing First and housing-led. How does that help us to move forward in our own context? And we were having discussions yesterday at coffee about how, context can be very different, but a lot of the work that we're trying to do is very similar across countries. So we hope to have a bit of a combination of that, like things that are that will sound very familiar to you, but also some unique things that are different in different countries. So my name is Samara Jones, and I coordinate the Housing First Europe Hub, which brings together federal ministries, governments, ministries of housing and social affairs from countries like Belgium and France and Austria and Spain, as well as some cities, big organizations, small organizations. We were kicked off in 2016 by FEANSA, the European Network of Homeless Organizations, as well as Y Foundation in Finland. And we came together with a lot of organizations to say, okay, if housing is a solution to homelessness and Housing First is the key piece of that, how can we work together to make sure that we have high quality training, we have good research, we have good advocacy to make that happen? And so we've been working together with many people in this room and all the people on this stage and a lot of people beyond the room as well. And I think it's really helpful to think about how our collaborative efforts are helping us all to move forward in our own context. And we might even think about, at the end of today's session, to think about the European level context, because that's different and new at the moment, and there is maybe some potential with this affordable housing plan. So if that's something interesting, we could maybe have some questions and discussions on that at the end.
Good morning, my name is David Valoch and I'm from Prague. I'm from Platform for Social Housing and I'm proud to represent here this wonderful organization that I will describe later.
Hello, my name is Muriel Alla. I'm from Brussels, Belgium, and I'm co-directing a Housing First program for 12 years.
Good morning, everybody. My name is Julia von Lindern. I'm the CEO of the Federal Association Housing First in Germany.
Good morning, everyone. My name is Emine Özkan. I am the director of the Association Housing First Austria and responsible also for the federal program Wohnschirm Housing First on behalf of the Ministry of Social Affairs. On the slide, you can see, first of all, Wohnschirm Housing First is a federal program in Austria by the Federal Ministry of Social Affairs. And we have a population in Austria around 9 million people, so it's a quite small country with a very interesting housing situation. As you might know, we have a very strong social housing system, meaning limited profit housing associations and also municipal housing. But still in Austria we do have homelessness, and there are around 20,000 people registered as homeless each year for a few years now. But of course this number does not include all the people who are in hidden homelessness. So the umbrella organization of the homelessness services in Austria, BAVO, thinks that the numbers must be twice as high as 20,000. So in Austria, the Federal Ministry of Social Affairs owns a program called Wohnschirm, which translates in housing umbrella. Housing First started a year ago in 2004, and by now we have in 7 federal states, 7 out of 9, we have 51 service centers, Housing First support centers, run by 26 different NGOs in the country. They provide social work, they allocate affordable housing, and accompany the people before, during, and after moving into their new flats. There are more than 170 different associations or cooperatives in Austria. But unfortunately, there are also obstacles to get or regarding the accessibility of these flats. So the program, Housing First Austria, is we are like taking these obstacles by paying the upfront costs before a tenancy contract is possible. You might think of deposits, as you may know in your countries also, but in Austria there is something which is called Finanzierungsbeitrag, which is a kind of upfront costs depending on the construction costs of a building. Other strategic services we provide is knowledge management. So we do provide Housing First training for the participating social organizations, such as webinars. We do have a community of practice. We have like annual gathering like this, but for like, in a smaller setting. And yeah, we do. We also offer a knowledge platform, so to have exchange about different topics.
Now we move on to David to tell us about Czechia.
Okay, so the situation in Czech Republic is maybe quite similar to what was described yesterday by the people from Sweden. There is something like 12,000 people in rough homelessness, but the problem of homelessness is much worse in Czech Republic because there is almost 250,000 of people that are living in bad conditions, in squats and things like that, or gardens, cars, and we are trying to solve all this problem and to make a policy towards this problem in Czech Republic on all the levels. So I think the strength of Platform for Social Housing is this complex approach, because we are trying to influence government, the local governments, politicians, also the chefs or bosses of the big NGOs. Thanks to European Housing First Hub and training for trainers, we came with the Housing First trainings for 1 day, which is like delivered to people from state administration and people from NGOs that are just cooperating with us. And then there are 2 and 4 days trainings, which are for people who wants to really do Housing First. It's really important for us to keep the brand of Housing First on some level, yeah, that is that we can be proud. Yeah. So there are also other things we are doing, like publishing some texts for the people, I don't know, for this fidelity assessment and advocacy. So we are also writing articles to some newspapers on social media, just to describe the situation of the people and to have some nice stories that this approach really works. So this is in a nutshell about Platform for Social Housing.
That's great, David. I think especially what you mentioned about the training, I think it also echoes a lot of the training we do at the Housing First Europe Hub, like you mentioned, and also I think in other networks, that the training isn't necessarily just for frontline workers to be able to deliver high quality support and services, but it's also to create a space where you can train and build a network of advocates and champions for Housing First who then go on to do really different kinds of jobs.
We've got massively increasing numbers of homeless people and rough sleepers in Germany. So we've got a lot of things to do in Germany. But even if we talk about 50,000 people on the streets and Housing First in Germany, it's not that many people on the street, that many people if you think about 83 million people in Germany. So if our goal is to solve this problem, it's not that big group. So we've got some facts about Housing First as well. We started the first Housing First program or service in 2015, so it's a 10 years old discussion in Germany, not that long. I know. We started in Düsseldorf. Then a few other programs or services started in the next years, and we had a first network meeting in 2020 because everybody was able to work online because of pandemic. So we had a connection with more than 20 Housing First services then, and we checked that there was a discussion about both models of Finland and US, but nobody was really strong in discussing it. But most of them were starting with a US pathways model. So there was a desire, there was a big discussion, like almost everywhere, do we need Housing First, what kind of Housing First, which target group, all this stuff. And there was a desire for professional Housing First association as a special association, just doing Housing First topics. So we started that. We founded an umbrella organization, Housing First, in 2020-23, and that's what I'm doing now. And actually we have more than 30 organizations actually organized in Germany. We've got almost 50 Housing First services all over Germany, and most of them are organized with us all over Germany. And we've got a federal government since last year, which is a bit special because normally if you're a young organization like we are, you don't get this funding. So we're a bit proud of doing this and that we get the funding and to have Housing First as an important theme in the political discussion. Nobody has to find out a new solution so we can learn from each other. It's important to have it. And of course, we are working on different levels, like working with municipalities, communities, state, federal, international level, all this stuff. But I only have one slide and we're discussing, so that's my presentation. Thank you.
Thank you, Julia, but don't worry, we'll give you more time to talk. I'll now hand over to Muriel for a bit about Belgium.
Yes, what you just said is the perfect transition to introduce myself, because I'm actually not the Belgian coordinator of Housing First, because there is one, but our function and our fundings are not secured at all, actually, because the new Minister for Social Integration is a right-wing Flemish nationalist, who shows a great disinterest for homelessness issues and for everything related to federal coordination. So we have a problem with this coordination in Housing First in Belgium right now, but the good thing is that Housing First is managed at the regional level in Belgium. So at this scale, at this regional scale, things are going well, but we really missed a national coordination. I remember my first days at work, it was at the Housing First Europe conference in Amsterdam. Maybe some of you were there, and it was really exciting and wonderful to start a new job and discovering all these really interesting project and this big movement towards Europe to change the homelessness and the mental health sectors. It was really, really great to start with it. And I had the chance also to be part of the train-the-trainer sessions Mr. Mauer and David. And yes, definitely working with the European level is really helpful and really important to do housing first. At the Belgian scale, we started the program, so in 2013 with a really great national coordinator with fundings, with the support of the administration, of the minister, and we had the opportunity to build up a 3 years experimentation and to develop the project. So the first years were really great, and our coordinator was really skilled in communications. So she really helped to spread up the model and to develop it. And now I am managing a project in Brussels that we housed and supported more than 120 people. At the Belgian scale, we have a little less than 6,000 persons living on the streets or in shelters, the Ethos 1 and 2 categories. And we count 46 projects in Belgium, 21 in Flanders, 16 in Wallonia, and 9 in Brussels. So you really see the regional scale. Housing First, it's managed by the region and not so much in the federal level. And Housing First Belgium has the opportunity to rehouse and support more than 2,000 people in 10 years.
Great, thank you, Muriel. I think, yeah, it's linking to that issue around the national coordination and needing that sustained funding is, yeah, it's really important. I think it's also quite interesting to be able to talk about, yeah, national level in a federal country, like Germany, like Austria, where even if it's not the national federal level's responsibility or jurisdiction to deliver services in housing or in support, that role is really essential, that it's a national level role to bring all of the actors together. So yeah, I think we could perhaps talk about that too, because I think it's a very important, but you have to be quite diplomatic in your advocacy around that. So we understand that, but we hope that working together it can be helpful.
Which differences did you find here in that Congress between your jobs in LA or in the US and in Europe? Big differences?
Yeah, I mean, to me, at least at this conference, there's a very strong emphasis on providing scattered site housing to people so that they have their own home. In Los Angeles, where I'm from, we've sort of moved towards needing dedicated housing, single site housing where everyone in the building has been formerly homeless. Which creates a lot of challenges to do it that way. So it's interesting to hear the commitment to housing first fidelity here that I don't hear where I'm from.
What is similar?
What is similar? A lot of the obviously the target population who we're trying to help, and some of the challenges in providing the funding for adequate services for people, and how to make that seamless so that people can get all the services they need in one place. It seems like that fragmentation is pretty similar in both places.
How important is such a Congress for Housing First in the world?
Well, I think it's taken on increased importance to the extent that, there is a very quickly shifting political landscape. And so, in the United States, we very much embrace housing first for a long time. And now it's sort of...
the world is learning from you.
The world is learning, and we are going backwards in time. We're embracing policies that we know didn't work in the past. And it seems like that's driven by, political reasons. So it's interesting to see, and to some extent, in Europe, they're much more embracing of the evidence base than we currently are in the United States. So I think it's important to keep that conversation and to learn some of the lessons of where things went wrong and how to avoid them here in Europe.
Thank you so much.
Yeah, thank
That's
you.
it.
Okay, great.
My name is Lyndon Bond. I'm here with my colleague Kristen Gerdak. We are from the United States, and we are going to be presenting a brief overview of a scoping review we did around community integration among youth experiencing homelessness, a little bit about what we learned as it relates to what research has been conducted and what we know about community integration among youth experiencing homelessness in an international context. And then we're going to pass it off to our colleague Heidi, who's going to share about Housing First for Youth in Canada. So we're excited to share a little bit of this research with you today because, as we know, community integration and social integration are key principles of a Housing First program. All right, so a little bit of background. We know that homelessness among youth is a global issue. Around 20% of people experiencing homelessness in the US and Canada are young people, and we know that there are growing numbers of young people experiencing homelessness across Europe as well. And youth are particularly important to focus on given sort of like this critical time period of adolescence and emerging adulthood. And the stage of life is really full of different transitions. So when young people experiencing homelessness, it disrupts educational experiences, identity development, and social networks. So why are we talking about community integration? Well, when we talk about solutions to addressing youth homelessness, we know that the Housing First model provides great success, and particularly given its focus on not just housing, but community and social integration. So for this particular sort of project, we really wanted to focus on the principle of Housing First, which is community and social integration. We know how important housing is, and with this review and this research, we really wanted to go beyond just looking at providing housing to young people experiencing homelessness, but to better understand how young people experience belonging, identity, and participation. And so we looked at sort of these three different dimensions of community integration, including physical integration, which we see as access to different spaces and resources, psychosocial integration, which is really sort of like a sense of belonging and safety in community, and then social integration, which is really thinking about sort of young people's different relationships and networks that they have. And so as part of this review and our conceptualization of it, we know that young people experiencing homelessness, yes, of course, need housing, and then need more than housing, including wanting to feel part of a community, have a sense of belonging, and be connected socially. And that all of these things together are really important for long-term stability. Really, what I wanted to share is that the goal of this review and sort of this research was to explore and examine what research and literature is already out there and what do we know about community integration among young people experiencing homelessness in an international context. And we really wanted to identify patterns, themes, and gaps within the literature about both what we do know and what we don't know. And so, again, I'm not going to spend too much time here, but the big takeaways is that we ultimately identified 15 different articles, different studies that explored community integration among young people experiencing homelessness. And all of the research included that we're speaking about today happened within the last 10 years or so. And I think one of the things we wanted to highlight, and Kristen will talk about a little bit more, is that most of this research around community integration with young people experiencing homelessness occurred in Canada, with a few studies focusing on the US and one study coming out of the UK.
Well, so I think that having the perception of stability can be a really valuable construct. However, we do still have to contend with different barriers like stigma, poverty, and systemic inclusion, and many other barriers to community integration. So beyond housing, relational factors is something that came to be very poignant throughout our review. Relational factors such as mentorship, peer support, and informal networks were all showed to increase a sense of belonging for youth. Something that I thought was really interesting was this idea around identity capital playing a really big role in psychological integration. And I will come around to why I think youth adaptations can be really important in utilizing youth voices and building programs. Another intervention is SEI, which is a social enterprise intervention that focuses on employment and mentorship programs. That intervention led to increased life satisfaction. And then lastly, rent subsidies with a mentorship program, again, increased psychological integration. Together, I think that these interventions really show that supports beyond housing really matter. And if we were to operationalize community integration in a slightly different way, I think that it would improve the efficacy around housing first interventions as well, but we'll see. So some implications for housing first. I think that we should move from focusing on solely housing to focusing on housing plus.
Good morning, everybody. My name is Heidi Walter, and I am very excited to be able to spend some time with you this morning. I do come from Canada, a large city, Calgary, Alberta, which is on the west coast of Canada. I am here to speak to you today a little bit about Housing First for Youth, but something that has been really a forefront in some of our learnings so far this week around community connection, the importance of family, natural supports, chosen family, found family, and friends. So a little bit about the organization that I work with. If you haven't heard of Away Home Canada, we do have some branches throughout Europe and the United States as well. But Away Home Canada is a national coalition, and we're shifting the approach around youth homelessness from managing crisis through emergency services to proactive rights-based strategies focused on prevention. So we really want to think about things far upstream. Somebody yesterday in one of the sessions, I believe it was Jose from Lisbon, that really spoke about the importance of making sure that while it's important to support people when they are in homelessness, what does it look like if people never have to reach homelessness? And that's why we want to focus on young people. Housing First for Youth is a rights-based intervention. It is similar to Housing First. What I want to let you know is that back in 2009, so Housing First for Youth was born in Canada back in 2009. I was working for an organization that had the opportunity to open up the first Housing First for Youth program ever. We adapted the Housing First for Youth principles based on Housing First. So Sam Simbaris did help us figure out what the core principles, what we wanted them to look like. And so this was done in conjunction with him and one of my bosses, Dr. Stephen Gates from the Canadian Observatory on Homelessness. The thing that we learned really quickly was that Housing First principles, while they are excellent, they weren't going to fit for young people. And so we needed to have a different approach for young people, and we needed to make sure that the services that we were providing them, because they are developmentally different, they're at a different stage in their life, and so we need to treat young people differently than we treat adults. Hospitals do not eliminate sickness. Housing First doesn't eliminate homelessness, but it saves lives. And that is something that I show up with work every day. I'm going to say very clearly, I get nervous when I share this slide, but I want to give people an idea of what it is that we are working within when we talk about Housing First for Youth. This is not an exclusive list. I had a young person in my training a few months ago. The average length of stay, because everybody always wants to know this, the average length of stay in a Housing First for Youth program in Canada is 2.5 years. Nobody wants to stay in a program. Young people want to go live on their own. Nobody's staying for forever, so don't worry about doing Housing First. For youth, they're not going to stay. And I'll speak to any government official that you want me to, they're not staying with you for 10 years. But one of the things that we said was, this young person had said, if I'm only in this program for 3 or 4 years, That is just a small percentage of my life. What are you doing right now to help me get ready for the next 92% of my life? One of our projects last year, these are the results that we are seeing by implementing family natural supports. We are seeing a serious increase in young people's sense of belonging. We are seeing a huge decrease in shelter time and in shelter usage. We're seeing an increase in quality life. We're seeing an increase in communication. We're also seeing an increase in mental health, and this is also coming from their families, whoever they've had their families, whoever they've designated as their families, sorry. And so if you would like a piece, this is a beautiful one-pager. If you would like this, I'm happy to give you one. But this is true data that is coming from young people. Only young people's voice has been captured in this data. And nobody can say that they're lying because it's all them. And so, yes, so it is working because you have to build trust, you have to build relationships, but you also have to make sure that they understand and be honest that we're not going to be there for forever.
Be better to say, you know, I'm here for you now. I am here for you. And we don't know how far it goes, but unless you provide some sense of assurance that you're the person that the young person can rely on, I imagine it would be hard to build that level of trust. I have to say, just before I said that, what I would have liked to say is I love the emphasis on it's transitional and the hope is to go past and we want to disengage and we're not here forever. All of that is terrific. I'm just kind of the nuance of assuring some level of comfort, I think might be different in terms of the relationship building.
I was sharing that I have never felt so inspired and never been to a conference that have given so much hope, that I've heard so much vulnerability, so much humility, and so much honesty from all of the presentations around the importance of the work that we're doing, the importance of natural supports, the importance of social inclusion, community integration. And I just think it is so amazing that we're finally having these conversations, not just in one room, but in all of the rooms, to understand that everybody that we are walking alongside and supporting deserve community and deserve belonging.
Good morning, everyone. As you can see, my voice is still a little bit strained, but I do my very best. Hope you had a wonderful time so far. We had a fantastic day yesterday. Thank you very much for this great event from the name of the board of our umbrella organization. I can see that most of you look happy but exhausted. So therefore we agreed on this panel, on this final plenary session, to just get in a friendly conversation with each other. We want to talk about social integration, health, hope, community in the field of Housing First. And we immediately agreed in preparation of this session that we want to do 1 or 2 statements each, but then get in conversation with you. So don't hesitate to ask any questions, give statements. This is really appreciated. I'm happy to be here with Amy Hutton. Amy Hutton is our first panelist. She's Director of Services in Sirenians. Thank you very much. A Scottish charity taking a public health approach to homelessness. They focus on prevention, early intervention, community building through food, green spaces, and relationships. Welcome to you, Amy. So my first question would be, people who have been rehoused after homelessness, after the struggle, often struggle with building social networks again and feel part of the new community. Why is that kind of social work so important, and what makes it challenging to achieve, and also what role can organizations play in helping people to connect and belong again?
Thank you, and good morning. It's lovely to be here and to see you all. So firstly, a sense of belonging plays such an important part in people's health and well-being. And I want you to have a think now about if your life was disrupted and perhaps you had some adverse experiences when you were younger, you didn't engage in school, you have no school friends, perhaps you moved around, you have no contact with your family, perhaps you've never really worked and made those connections through employment, perhaps you had your own family but you have no contact with your children anymore. Not many of us have to start with that sort of blank sheet of paper, but many of the people that we support to be rehoused after a period of homelessness will have to make that beginning again. And I think that we make this much worse with a lot of the support that we provide for people who are experiencing homelessness, because traditionally what we focused on was teaching people how to become independent, how to manage themselves. And some of the support work that we do can help model that relationship. So showing people compassion and genuine regard. And that, for me, is the type of relationship that can be taken elsewhere in people's lives. So you model the good relationship through your support, and hopefully the person can take that into the other relationships that they encounter. So I guess to sum up, we know that bad relationships are really damaging for people's health and well-being, but I think good relationships can be a wonderful medicine.
Thank you very much. Thank you for that strong statement. Piotr Olik, social worker and sociologist, you coordinate the implementation of Housing First in several Polish cities, and you're working with people experiencing long-term homelessness, mental health challenges and addictions, and you also serve as the president of the Polish Housing First Association. How do you integrate health, hope and community within this special Polish context, particularly in the implementation of Housing First across several Polish cities?
Thank you for the invitation. Congratulations on the whole event. It's a great honor and a privilege to be here with you. So we have been developing Housing First, it's called in Polish najpierw mieszkanie, for more than 5 years, so we are still at the early stage developing. But in the context, until recently, was dominated by shelters and institutional support. So I would like to share with you our experience of building Housing First as more than housing, as a bridge between health, hope, and community. So basically, we've learned that providing people home is just at the beginning.
So when the first Housing First programs appeared around 2020 in Warsaw, Gdansk, and Gdansk is my city, as you can see, Wrocław, it was the revolution. So we discovered that even in a system not designed for it, people were ready for housing. It was the system wasn't ready for them. So we have 3 key lessons. First, housing is health and healing. So we quickly realized that the first months in an apartment often becomes the first moment of healing. Not only physical, but emotional. Of course, healing is the process. It takes time. It is continuum. So often after moving in, the physical and mental health is collapsing. So for the people who lived for years on the streets, home means safety and body and nervous system sleeping without fear, eating when you want, closing your own door, having a key in your pocket. It is crucial to have a peace, safety, and dignity. Second lesson, housing is hope in the neighborhoods. So that is why we see Housing First as a community project, not only social project. So the key thing for us is to connect in Housing First support with local services, just like health, education, culture, sport, employment, to make it the inclusion as a shared task. To summarize, from Polish perspective, Housing First teaches us that health starts from safety.
Sometimes in Germany we say the housing is only the infrastructure of this mission, but hope is the secret ingredients that helps people to recover. Thank you so much for that great statement. Kenia Nikali. As good as it gets today.
Very impressive.
Yeah, my Gaelic is a little bit rusty, but I have Bob with me, so. Good to have you here. You're Associate Professor at Clinical Medicine at Trinity College in Dublin and Consultant in Infectious Diseases and General Medicine at St. James Hospital. And you lead the Inclusion Health Services, which aims to improve access to hospital and specialized care for people experiencing homelessness and social exclusion. Good to have you here.
I suppose I'm a doctor, so people say to me, why are you interested in homelessness? Sure, that's a housing problem. And I go, well. So I was trying to think through what do I think that healthcare workers, doctors, nurses, all of us can do in relation to Housing First. And so I work now more or less exclusively with people who are socially excluded, which is a lovely, lovely job. So healthcare workers can do lots of things, I think, to support Housing First. First of all, they can advocate, because when you work in a hospital, everybody who turns up at your door, something has gone wrong. Usually, I think it's a little bit like the beach where all the, stuff that has come out of the shipwreck washes up. And so it's very clear when you work in an acute hospital to see what's not working in your society. And in Ireland, we have a really big housing crisis, and I think it's really important for healthcare workers to be able to say this is having a massive impact on health, and as a result, it's having a massive impact on our health system, which is overstretched. And I think it's also really important to be very clear as a healthcare worker that healthcare interventions will not work unless you have addressed people's basic need for physical safety and a key and control of who comes in and out of their own home. So having had the lifetime of trauma that usually leads up to homelessness and the physical and emotional toll that being homeless takes makes people incredibly sick. And, I work with people who are in their 40s, and biologically, it's like they're in their 80s. They have osteoporosis, they have dementia, they have COPD. And then I think, thirdly, we can work directly with providers of Housing First to support them in a number of ways. The first thing that I would say to other healthcare providers when you're working with somebody who is homeless is frequently they may not have family members who do the traditional coming to their appointments with them, explaining what the doctor has said, reminding them about their medications, all that unseen work that happens, and or caring for people who have a fair amount of support needs in the home. So that as a clinician, you have to pass the information that you would normally pass on to a family member. You have to think that their key worker or their case manager is that person who's going to provide the consistency. So we can do that. Sometimes we can be helpful in telling people in Housing First what to expect. We also can identify people who would benefit from Housing First. And that's one of the best things. We were talking yesterday over dinner about a guy that I had seen in clinic who had been rough sleeping. I was really impressed because he sewed his own clothes out of leather trousers. He'd made this really cool motorbike jacket. Anyway, he's now in a Housing First tenancy. He'd been lost to follow-up because he was able to stay under the radar. He's now getting his own key and his chronic disease is managed. So that's a massive win.
Does anybody need an introduction for Sam? Raise your hands. No, Sam, good to have you here. Actually, you are the one who brought us all together. We have to highlight this.
I actually asked to be on this panel, so I'd be sure not to miss it, because I knew it was a great panel. I wanted to hear all about this issue, which I think is the issue of, what happens after Housing First. We have the stability, we have all of that, and I just have a couple of comments from what was already said. Really, nothing new to add, but I thought that all these things that we're talking about in terms of these interventions are creative, essential, all of the things that people need, but I'm reminded of the fact that they all take place in the context of a relationship with the program provider. And that is so essential. That relationship, I think, underemphasized, but is the vehicle for any of these interventions that we're talking about to happen. If you don't have a trusting and fluid and positive relationship with your caseworker, you can't get to the next step. So if we're going to seriously take on community integration, we have to resource it so that it allows, everyone we're dealing with is living in poverty. And so otherwise it's just talk and not the walk. So we need the resources, flexible, committed, and sometimes that's hard to get. How do we manage a program that has time unlimited services, as a promise, and yet also able to pull back and be flexible and see people infrequently and then escalate when we need to? And how do we integrate, the healthcare system with the community piece and the housing piece? These are huge systemic issues.